Hello, welcome to the Florida Hospital for Children webinar. Today we're going to talk about cochlear implants. This is a state-of-the-art treatment of hearing loss, and I hope you find this talk very informative. First off, my name is Dr. Joshua Gottschall. I'm a fellowship-trained pediatric otolaryngologist or ears, nose, throat surgeon. I have had specialized training in advanced pediatric ears, nose, throat surgery and head and neck surgery. And I'm also an otologist with an interest in cochlear implant surgery. I have performed over 100 cochlear implant surgeries and do many ear surgeries in general. I have interest in all sorts of ear, nose, throat disorders, but treating hearing loss is a passion of mine. I'm thrilled to be partnered with Florida Hospital for Children to create a state-of-the-art cochlear implant program for pediatric patients and adult patients in Central Florida. So what is a cochlear implant? You might have asked yourself this. A cochlear implant is an electronic device that restores hearing to individuals with severe to profound hearing loss. And these are patients who have tried conventional hearing aids, and their hearing loss is that bad that conventional hearing aids do not provide them benefit. On this slide, this shows the cochlear implant device. There's actually two components to a cochlear implant. One, on the left, is a device that's implanted surgically by a cochlear implant surgeon into the cochlea. On the right is the external processor, which houses the microphone, the battery pack, and the electronics that drives and programs the implant. Currently, there are three major cochlear implant manufacturers worldwide. And at our Cochlear Implant Center, we offer all three manufacturers to our patients. Once a patient is deemed a candidate for cochlear implant surgery, that internal processor, or we call it receiver stimulator, is surgically placed within the cochlea. The cochlea is a snail-shaped structure where sound transmission occurs, where sound is transmitted from sound and pressure energy to neural energy. On the right-hand side is a diagram, an actual patient wearing the external processor. Let's talk about the anatomy of the ear and how normal hearing normally occurs. In this picture, we see our external ear canal. The ear canal is where the earwax would form. And inside, deep into the ear canal, we see the eardrum. The eardrum separates the external ear, where the ear canal is, from the middle ear, as marked in this picture. Within this middle ear is an air-containing space and are three bones of hearing, the malleus, the incus, and stapes. The majority of ear disorders in children occur in this middle ear. This is where your routine ear infections occur. Beyond the middle ear is the inner ear, where we have our cochlea and labyrinth. The labyrinth is responsible for normal balance. The cochlea is responsible for hearing. The types of hearing loss that can occur in patients is quite varied. And it's very important to identify what types of hearing loss is occurring because the treatment is quite different for each. Moving from left to right in this slide, we're showing portions of the ear and where certain diseases can occur. On the left side, we see the external ear. On the middle slide, we see the middle ear. And diseases and disorders in these two locations cause a type of hearing loss we call conductive hearing loss. Sound is not conducted into the inner ear or cochlea in a normal fashion. Causes of these type of hearing loss can be as simple as a foreign body or wax in the ear canal, to an eardrum perforation or fluid in the middle ear. These type of hearing losses are generally treatable with either medicine or sometimes more basic surgery. If disease processes occur in the inner ear, as shown in the far right picture, this is generally believed to be nerve damage, and there's no real treatment for this type of hearing loss short of hearing aids, and if bad enough, cochlear implants. So what is the impact of hearing loss? More than 36 million Americans have some degree of hearing loss, and an estimated 3 out of every 1,000 children in the U.S. may be born with hearing loss. In about 1 in 3,000 kids, this hearing loss can be severe. It's one of the reasons why that we have in most states a universal newborn hearing screening program. That is, before your child goes home from the newborn nursery, their hearing is tested. And if they fail that test, they're referred to a hearing specialist and onto a ears, nose, throat specialist as well to diagnose and treat their hearing loss. Whether hearing loss is present at birth or happens suddenly or gradually over time, hearing loss can leave you feeling isolated and separated from friends and family. If the hearing loss is not addressed in a very young patient, this can cause significant delays in speech and education. Some patients may have to find alternative means to communicate. So this is a very important problem, very common problem, and very important to recognize to treat very early. The majority of people can treat their hearing loss with traditional hearing aids, while other degrees of hearing loss may require more advanced treatment, such as cochlear implants. The cochlear implant team is comprised of specialists in their specific fields of expertise. As a cochlear implant surgeon, I provide the medical and surgical evaluations to determine if patients are good candidates for cochlear implant surgery. Other members of a cochlear implant team typically includes speech pathologists, educators, nurses, and others. So what's involved in the cochlear implant evaluation? Once you've made an appointment to see us in our cochlear implant clinic, you'll first have a consultation with me and have an evaluation of your ears, a very careful evaluation to determine if your child does have hearing loss, what the possible causes and treatments are. Not everybody needs to have a cochlear implant. You'll have a generalized physical examination to determine if you're a good candidate for surgery. You'll have hearing evaluations with the implant audiologist, and oftentimes more than one, to determine the degree of hearing loss and whether the hearing loss is stable or not. In addition, it's quite common that a trial of hearing aids be initiated for a period of several months to determine if cochlear implants would be appropriate. Finally, it's quite common when cochlear implant surgery is likely to happen that we will order some sort of radiologic imaging, such as a CAT scan or MRI. It's important to confirm that there is a cochlea to implant. So again, who's a candidate for cochlear implant surgery? It's very important to remember that cochlear implants are not for all forms of hearing loss. It is reserved for patients who have severe to profound sensory neural hearing loss in both ears, and those that receive really no benefit from hearing aids. We have to make sure the patients are healthy and fit for surgery. And we have to counsel our patients to make sure that they understand the process is not just surgery, that there's a significant amount of follow-up after surgery for programming. We would like to have patients and families who are highly motivated, and we want to make sure patients' expectations are met. What are the benefits of cochlear implants? Well, cochlear implants serve to bypass the damaged portions of the cochlea and stimulate the hearing nerve and thus the brain directly. We expect patients with cochlear implants who had formerly no options to hear again. And hearing can be from simple everyday sounds such as traffic sounds, sirens, and alarms. If we got no other benefit other than this would provide a significant safety advantage for patients. Imagine not being able to hear that car horn when you're stepping into traffic. But we expect more from cochlear implants, and luckily we get a lot more from cochlear implants, including the ability to hear speech. Patients can hear speech and understand speech in such a way that they can communicate and interact with their peers and family and loved ones. Many patients who have cochlear implants can understand speech without speech reading or lip reading. In addition, now that a patient can hear their own speech, they can refine their ability to speak more normally. Many patients with untreated hearing loss have what we call deaf speech, and that's because they can't self-monitor their own speech. With the advances of cochlear implants, our bar has been raised tremendously. Not only do we want to be able to understand speech, not only do we want to be able to develop normal speech, our bar is now we want to be able to appreciate music at a very high level. We want to be able to talk on the phone. Imagine this is a patient who normally would have no other options to do these things. Once again, it is essential to identify and treat hearing loss in young children very early. Children who have severe to profound hearing loss, if we do not intervene on their behalf, might not develop speech or abilities to communicate orally. We can perform cochlear implant surgery in children at 1 year of age, or sometimes even younger. If we do this for these children, they will stimulate their brains to hear sounds and eventually develop speech. And our goals ultimately is to have the child be able to attend regular school just like any other child. Factors that affect the degree of benefit in patients who receive cochlear implants depends upon age, when their hearing loss was identified. Ideally, in children born with hearing loss, we want to identify their hearing loss and treat it before the age of 2. We also have to see what the status of the cochlea is. Is it a normal shaped cochlea? And what other medical conditions might be impacting hearing loss and development of speech and understanding? Well, I want to thank you for joining me during this webinar. This is a very interesting topic and I could speak on it for hours. If you have further questions, feel free to contact me and I'd be happy to answer your questions. Or if you'd like to make an appointment to see me or one of my cochlear implant team members, feel free to call the number on the slide below. Thank you.